Welcome, everyone. Thank you for joining this session today. Hopefully, you are doing fine and you're having a great week. So let me give you the welcome to the first meeting, to the first webinar from the LAC platform 2024. So my name is Karen Danaway. I'm the communications section of the LAC platform. So for those of you who are familiarized with the webinars and how we work in the platform, we have several changes. So we have been organizing, and now we move on from having an approach, not only having an informative approach, but also to have a more technical approach. So in that sense, and in order to start this new year, we would like to continue with this safety and protection issue, which we consider it's important. That's why we decided to start with this topic, developing this workshop for those organizations who work with key populations and HIV in Latin America, and within the Global Fund grants with regards of the topic of safety and security. Last year, we launched the toolkit on protection and security for organizations who work with key and vulnerable populations. And in a certain way, I will also include the link. You will find it in English and in Spanish. So the purpose is to generate a discussion and also to be able to map with regards of the risks that we are facing as civil society organizations whenever we are trying to protect and whenever we are lobbying for human rights, as well as on prevention and care for key populations. Also, the idea is to give you general guidelines in order to avoid any type of risks with regards of safety and protection. So before getting in depth, let's give you a reminder as the beginning of any other session, the good practices so we can have a good and productive session. Reminder to keep your microphones muted, and also to be in a space where the background noise is not listened through the webinar, and also be mindful and respectful of the other. We have several points in the agenda where you have a calendar in there. Within that, there is a link for you. Then there are several spaces for you to participate for the Q&A, and we will have a dynamic session here so we can put into practice all the guidelines that will be given on how to develop a protection and security plan. Also, this session will be recorded. It will be uploaded into the LAC platform website. So for those of you who are interested in coming back to this, it will be there available for you. Also, this webinar includes the simultaneous interpretation into English and Spanish. So in order for you to have access to it, you need to click on the icon, on the world icon, and then choose your preferable language. If you want to listen to the whole session in Spanish, remain in the Spanish language. If you want to listen in English, also select English channel. And if you are at the cell phone or tablet, you can also click on the three dots on the lower right-hand side area and also choose simultaneous interpretation. So now I give the floor to open the session to the Global Fund. On behalf of the Global Fund, we have Mateo Casolato. He is Technical Assessor of Key Population in the Human and Community Gender Department. Mateo will participate in English, so therefore I invite you to choose the Spanish channel. So I now give the floor so we can open the session.
Gracias, Karen. Y buen día.
Thank you, Karen, and good morning, everyone, everybody.
My Spanish stops here from now on. Yes, from now on I will be speaking in English. Let me just switch my sorry, my translation, because I can. Okay, that's it. All right. Are you? Can I ask you to share, please? To please share my slides.
Anwar, ¿puede compartir la PowerPoint?
Okay. Mateo, you have your PowerPoint in your computer, or should we?
Oh, I sent it, but I can share it. It's no
Oh,
problem.
ok. Pensé, Anwar, que se iba a compartir las de Mateo. I can do it.
Ah, thank you. Yeah, maybe it's better. So that thank you, apologies for that.
Can you see it now?
Yes, I can see it properly. Thank you so much. So I can start. Okay. So first of all, well, hi, everyone. My name is Matteo Casalato, as Karen was saying, and I work as a key population advisor in the Community Rights and Gender Department of the Global Fund. First of all, I would like to thank Via Libre and the Lab platform for inviting the Global Fund to give some introductory remarks to help frame today's workshop. I will do so by first trying to explain why the Global Fund has made security a priority in implementation of KP programs, and then by discussing what the Global Fund is actually doing to strengthen the security program implementers, beneficiaries. I have a few slides to show. I've tried to translate them in Spanish already, but I do apologize for any errors. So we can go to the next slide, please. Okay, so why is the Global Fund, has the Global Fund made a security of KP programs a priority? So we all are aware that in many countries there are still laws and policies which constrict civil society space and criminalize communities effectively. These laws impede effective health, the health response, the HIV response as well, and put the safety, security, and well-being of populations at risk. Not only laws and policies, though, we're also looking at stigma, discrimination, and violence, which exist at societal level, mean that key populations in the context of HIV also face security threats, incidents in their social private lives, not just within the health systems, facility settings. Now, regrettably, in the last years, the situation, or we can go back, sorry, to the now, regrettably, the situation is not improving, right? It's actually it's deteriorating. Say. We are seeing that there is an erosion of human rights in many regions of the world. We could actually say in all regions of the world, sadly. And particularly, we're noticing a wave of attacks that affect the LGBTI plus community. And this is not just happening because it's not happening out of the blue. There is a global anti-rights and anti-gender movement, which is partly responsible for this. And this is really threatening the gains we made in the AIDS response in the last 20 years. We, as funders, like as the Global Fund, we do have a responsibility to ensure that key population programs protect those they serve and also those who deliver programs, meaning the community-led organizations, the key population-led organizations, like I hope many of you, to really keep you secure from. Yeah, and we can move now to the next slide to see a bit what the Global Fund is actually doing to strengthen security in KP programs. So we have adopted a number of strategies, as you can see here. I've put here the 4 main ones. So the first one is really trying to protect people from the risk of sexual exploitation, abuse, and harassment perpetrated by program implementers, healthcare workers, but in some cases also by beneficiaries. And to do this, we have something called our PCEAH strategy, which is something we require all Global Fund implementers to enable adopt and respect, and commits us all to report any issue of abuse or violation of the strategy that we get to know of. Even if we're not directly involved with it, we have a duty to report on this. Second strategy is about everything under our human rights programs. And these are really aiming at ensuring the broader security situations that are faced by the population. It's about tackling those structural drivers of the AIDS epidemic, for instance, criminalization, violence, policies that rather than protecting the populations, they criminalize them or they exclude them from services and act as barriers to services. A big example of this strategy is also shown by the Breaking Down Barriers strategic initiatives, right, which provides technical support to specific countries. In this cycle, 24 countries are receiving this particular form of support, additional to the typical human rights investments. Third strategy is around trying to really push and ask for grants to include program security measures. Yeah, and we do this both when grants are being designed, so when the funding request is being put together. As CRG, we work with the cities, we work with communities to ensure that through the national dialogue process, these activities are being included in the funding request. When this does not happen, or when it doesn't happen to the extent that it makes sense, when the funding allocated to security measures is insufficient, another strategy we use is the rapid reprogramming of savings to ensure that then they can address these particular needs. And the fourth strategy is around really providing technical assistance. And this comes in a number of forms. I believe this webinar is actually one expression of it, and it's led by the Plataforma LAC. But there are many others. CRG directly is providing technical assistance to a number of countries to understand, first of all, and to organizations who implement global fund programs, and also outside of those, who want to understand what security means in KP programs. What are the capacities that each organization has when it comes to implementation of security measures, but also to enable them to identify what are the gaps, what are the weaknesses, what are the threats and the risks that their staff to face every time they work, time they find themselves within the premises of the organization, but also when they are outside doing field, for instance. And to do this, obviously, we have a number of consultants who can provide this type of support, which then ideally leads to the creation of security plans and then cost them. So then each organization understands what it should be doing to put in place a more secure KP program and what are the costs linked to that. And let me just say that many times a lot of these measures do not cost money. It's really about understanding what the risks are, planning, and thinking through what are the actions that I can take today to avoid something bad happening tomorrow. And this is it, really. I mean, in terms of what we're doing. Before leaving you, I would just like to show you what are the 10 security principles we try to use and follow in the support that we are providing. So quickly, if we go to the next slide, I'll be going through that. So I've divided them into slides because for the reasons. But basically, the first principle we're following is to always take decisions based on context. And to do this, we are always looking to the organizations on the ground to provide that advice, because they are the ones who know best. Second important principle is to always apply those basic principles also of the community HIV response, which is do no harm. And the second one is nothing for us without us. So always involve KP-led organizations, KP-serving organizations in understanding how to apply security measures. The third principle is to make security a priority, explicitly identifying funding for these interventions, right? Which is again the work that I was telling you earlier we're trying to do. Another one is understanding and making sure that everybody understands that security is a security in the workplace, extended to the outreach work, is a responsibility of the employer. It's not a responsibility of the peer educator out in the field. It's first and foremost a responsibility of the employer. Obviously, outreach workers have responsibilities themselves and should follow security measures that are put in place, but the responsibility comes from the employer. Fifth principle is to plan in advance. Think through what could happen. Think through what could happen if any of your staff is going to be detained or arrested. What are the measures that you can rapidly deploy to support them? Having a lawyer on retainer, for instance, and all these measures that you can think about to prepare for incidents that may happen. If we go to the next slide, I'll conclude quickly the last 5 principles. So always discuss with all your staff what is the acceptable level of risk that each staff is ready to take. There might be people who do not want to expose themselves to certain risks, and they should be put in a position to be able to say so. Always important to have the informed consent. And remember from the staff to do the things that they need to be doing, but remember that they need to be enabled to give informed consent. And this means they need to have a clear understanding of all the risks that they're putting themselves through. Always try to think through how to work in coalition with the other organizations. You are not island. Organizations are not island in the same context. They can form alliances. There are a lot of activities that can be done jointly, so they have more leverage, so they have more weight. And always remember that if an organization, you do something wrong that compromises your own security, very likely it will compromise the security of other organizations too. And then always very, very important, the 9th principle is think about the health, the mental health, the mental well-being of your staff. Working in an environment that poses risks and threats to our lives at times can be very stressful, is very stressful. So it's important that the organization is always ready to also try to think through how to offer forms of psychosocial support of mental health. And the last one is do not be afraid to talk freely and openly about vulnerability. At times we mistake vulnerability for weakness, right? This is not it, right? We have to create safe spaces within our organizations to be able to discuss what makes me afraid of doing my own job. What are the vulnerable things that I see in doing my job? Because once I know what they are, we can also address them. And I'm going to stop here. I hope I didn't take too much time. Thank you so much, everyone, for giving the Global Fund a chance to speak. And I wish you a very fruitful continuation of the webinar. Thank you so much.
Muchas gracias, Mateo.
Thank you so much, Mateo. Thank you so much for introducing and for starting this workshop on why is it's important and why is it that the Global Fund has been reinforcing security for promoters and for the beneficiaries of the program. And one of these things that the Black Platform has done in the last year is to reinforce. So within the agenda that was shared for this webinar, we also want to start on knowing exactly why is it that we need to do a situational diagnosis with regards to protection. What type of information do we need to know first in order to run a situational diagnosis? Or if, let's say that if we want to give some general recommendations, so we can identify what are those protection and safety risks within the populations and the organizations around our countries. So within that, we have someone that doesn't need any kind of introduction. You all know about him, and he's so dear to everyone. Here we have Anwar Lunar. He's the technical director of the LAC platform. He will speak about how can we identify those safety and protection risks and how can we deal with them. So Anwar, the floor is yours. Thank you so much, Ms. Anwar. Can you see the presentation? Thank you, Karen, for your words. So I think that. Can you hear me now? Anwar is asking. Maybe it's only. Yes, we can hear.
Okay, si no me escuchan,
okay, so if you don't, let me know, Cesar. So let me start with some ideas here and with some concepts that are needed so we can understand the whole process, not only for the diagnosis, but also for the preparation process. And then later on, our colleague Rosa Gonzalez will speak a little bit more on specific tools for us to develop these activities and how can we end with a plan on safety and protection. So on a regular basis, what we do
es a partir de esquemas de trabajo
presencial. What we do is that we do offline skin activities, but we have had a great experience with, we had 3 pilot programs with different countries, Belize and Guatemala, where we developed these off-site meetings. And recently, yesterday, we just finished an online session with El Salvador. So what I will share with you is a kind of a combination of those experiences that we had not only offline, but also online. So let me start. Some of the background information. So for Latin America and the Caribbean region, the violence topic is a recurrent topic. And for many other countries also, the issue of violence is not an exclusive topic for the NGOs that work with key populations, HIV, TB, and malaria. No. Unfortunately, in many countries, violence is generalized. So, after the year 2000, the sponsor agencies started looking at violence in such a way that how the lack of security in workplaces can impact in a negative way on the implementation of the programs. So in this case, we can give you some examples of the type of violence and type of situations that had been reported frequently, not only in Latin America, but also around the world. For example, detentions, imprisonments, and offices, facilities that are taken, and aggressions to physical aggressions to individuals. So as for these situations, we know that these are not exclusive of the rest of the world, but we have already identified those in Latin America. So in the last years, since 2018, the project Linkages, together with the Frontline AIDS, they developed a kill toolkit, and they systematized several tools. So from that, they had developed several tools so we can accompany these processes. So we, as LAC platform, since the year 2022, we've been developing and we've been translating and adapting some of those tools. But as I was telling you from the very beginning, also running pilot programs with several processes, offline processes in these countries that I have already mentioned, and also online processes as for the case of El Salvador. So let's say that this is the background and why is it that we're here and why it is important, and just reinforcing what Mateo just shared with us. So now let's start with these technical topics. And we will start with some definitions that are truly important to have it, to make it clear. So we can then start developing and working on that, on what is it that an organization should consider. So we will do it this way. I will state a question here, and then I kindly ask you to answer in the chat box the option that you consider is the answer to the question. So for example, here, the first question is, what does security mean? What do we mean when we speak about security? Is it security to feel safe, that we are totally safe? Or is it free of being free of any intended violence? Or it's just to have a first aid kit? So what do you consider is security? So if you can answer in the chat box, A, B, or C, so we can see exactly what is the idea that you have about security. So what is security? If you say that is letter A, letter B, or letter C. If you can write down in the chat box. A, there's one answer, A. What else? Who else gives his or her answer, the answer? A, B, anyone else? Two more? C.
Más C.
One more? Three of them? Fidelia says three of them. Okay, yes, it could be. It could be. But let's see exactly what is the answer. The answer is B, is to be free of intended violence. So we feel safe when we know that our personal integrity, and in this case also the institutional integrity, is free of violence, that no one with any intention is going to harm us. That's what we mean by security. But it could also be to feel safe and also to have a first aid kit. But those are tricky elements here. So we can go directly to what we want to express, which is letter B. Let's move on and let's see what is the next definition. So I kindly ask your participation, so we'll have, and we can move forward in this sense. So what does risk mean? Let's imagine Mateo spoke several times about risk, about this term. So what do we mean when we speak about risk? Are we speaking about the possibility that something might happen, something that is harmful that might happen? Or are we speaking about doing something very carefully? Or do we mean to plan in advance in order to avoid any danger? So whatever is that I'm doing right now will avoid getting me in danger, just to avoid that. So what's the answer? The possibility that something might happen, and to do something carefully, or to plan in advance. So what is risk? What do you think is risk? Someone is answering in the chat box saying that it's A or C. What else?
A ver, cuéntenme por ahí.
Please let me know. Give your answer in the chat box. Any other three who would like to answer? And the last one was A. So we have two A's. One more, please. Let's see exactly the meter here. C. Okay, then. C. Letter C. That's good. So it seems that we are between A and C. No one is mentioning letter B. So let's see the answer. The correct answer is letter A. Exactly. Risk is the probability that something harmful may occur. That puts us at risk. Let's say, for example, that when we are just in the kitchen and we're just close to the hot pan, the closer we get and the more intention that we have to touch it, then it will be probable that we will burn our hand. So planning is part of what we would like to cover, but that is not a risk as such. Planning is the way on how we are going to avoid that. So thank you so much. Let's move on to the next concept. And even though the word risk may refer to the possibility of suffer any harm, of something or someone that creates a danger. In this case, we will speak about risk as the possibility that something harmful may occur. Now, what do we mean when we speak about threat? The word threat, all these are very daily concepts, daily activity concepts. So a threat, should it be an indication or a sign that someone would like to harm us or punish us? Or is this a support declaration or a bad omen? What is the? Someone is answering, they are saying it's A, any other? A. So there is a consensus here. It seems that we have a consensus report that it is an indication or a sign that someone wants to damage us, so want to detriment, to harm us. So threats can be verbal threats, as I will harm you. However, threats could also be actions. In this training, we will speak about threats as something that comes from outside ourselves. That is to say that we won't speak about ideas of such as self-harming. No, this is not of whatever I'm doing to myself, but we mean that someone who is going to hurt us. So let's move on. Now, let's speak a little bit about the planning aspects. So what do we mean when we speak about skills? So the sign that someone wants to hurt us, wants to damage, or wants to punish us, or B, that is a financial resource, or that's a capacity, or such as the skills, infrastructure, or to have our own personality, that all these can be used in order to improve our security. And letter C, to see and to observe how is it that something is danger. So what does capacity mean? A, B, or C? I will repeat the answers. Letter A, this is a sign that someone wants to hurt us. Any resource, financial or capacity, contacts, infrastructure, or something that we can use in order to prevent. B. I think that this is also a consensus answer. Exactly, that's letter B. It's any resource, and the other, there's tricky answers. But of course, yes, when we have that capacity, we mean that we have the resource. And this could be any type of resource. This could be financial, or any other skills, or the contacts that we have with other organizations, with the government, with the police stations, with churches. Infrastructure, we speak about having an office, having equipment, having hazardous equipment, or being legally having this legal authority. And so these are the resources that we can use in order to answer either to the risk or in order to guarantee our safety. So in that sense, capacity could be anything. A great sense of humor can help us to calm any stressful situations. And later on, we will speak about this. Also, being connected with someone can avoid that we will be hurt, or just to have a card that has these armors. Let's move on and let's see what is vulnerability. So options are: vulnerability is anything that will increase our exposition for those who would like to harm us. Letter B, anything that we should do in order to keep us safe, and a sign that someone wants to hurt us. So what do we mean by vulnerability? They are just answering in the chat box and they are saying that it's letter A. So this is something that increases our exposition, and I think that this is a consensus answer then. So we are just speaking about this consensus, and I think I see that everyone agrees on this one, and that this is true. The answer to this question is letter A, any situation or anything that increases our positions for those who would like to harm us. And then the comment we have is that our objective is not to be non-vulnerable. That's not the idea. We're going out our home, going out the street, that makes us vulnerable. But being alive is being vulnerable. However, we can identify what our vulnerabilities are, and then we can determine if one of them can be reduced. So far, this is the questions section. Now let's move on. Let's move on the topic as such. So just note, when we speak about vulnerability, we need to understand that being vulnerable is not the same as being weak. Vulnerability is something that it is there in the environment. It is there outside. It is there that we cannot change because those are structural aspects. Laws can make us vulnerable, let's say. Also, the influence of such an ideology, for example, as governments that from the left-hand side or right-hand side, that make us vulnerable, but we cannot change those, and that doesn't mean that we are weak. No, that means that we are facing situations that are creating this vulnerability on us. So, being said that, vulnerability is something that is related with the context itself. There are several types of vulnerability that we cannot change. For example, race, gender identity, sexual orientation, and age. In some HIV programs, sometimes they ask transgender people to stop showing their true gender identity in order to reduce violence. So, however, we know that that's a mistake because that affects the right of their identity. So there are some other ways on avoiding vulnerability without harming the rights of people by changing what they cannot change. So in this case, gender identity. So the objective is to be aware of which are our own vulnerabilities and of which are the capacities that we have in order to act, considering also those vulnerability factors. That is to say that this is a prevention approach. And that is to say, how can we anticipate danger once that we know exactly what are our vulnerabilities? So far, so good? Okay, then. So when we are starting to plan a security and protection plan, it is important to consider these concepts. Why? Well, because that sense we can start organizing all things. So moving back to the first proposal on how to develop a diagnosis. So we have done it in those countries where we have worked offline. The first thing that we do is that we go exactly where we go at the places where the communities, where the health workers are developing their own activities. That is to provide the inputs or to take the tests or to give these prevention talks and so on. All the things that you know that belongs to the universe of these interventions to respond to these diseases. So during these activities, most of the times are done in offline schedules, no? That they are done not in daytime. We need to go to the bars, to the cantinas to give the inputs. And sometimes we have these situations that put at risk the security of those who run these activities. So the first thing that we do is that we go to the field, and we need to understand exactly what is the daily activities that take place. What are the situations that they face from the very moment that they move from the organization to go to these hot areas or to these intervention areas, to the communities. This could be done through the public transportation or the moment that they reach the bar, the park or the place that they are going to, depending on the place. We need to understand that creates a vulnerability to them. Why? Because they are exposed. They are exposed to several situations that it's difficult to handle. Therefore, the first thing that we need to know exactly is what's going on in the environment. what type of situations happen there, who are the ones who perpetrate those violent actions or aggression actions, to those who work, for those community health workers. And the most important is why. Why is it that they do that? So the first thing that we do is that we go there and we ask, what are those security and safety incidents that affect the health care providers? And we ask them to describe what happened. Let's say, for example, yesterday, if it happened that between this intervention, there was a problem there and there was a crisis and they were just in trouble. And if one person was attacked on this mobile section, so what happened? We need to ask what happened there. And then, or who committed that? And why? Why is it that they did that action? What are the motives that we consider? Is it because of transphobia, for homophobia, or if it's because of state discourse that goes against homosexual and transgender people, or let's say that there is this trend from the police department that they persecute people who develop these activities, or because maybe the church is not in agreement. So we need to understand exactly what are the motives that generate these activities or these situations to happen. So we have a list here on the places as well as on the type of people. So I won't stop here. I will continue now. And also the importance on documenting everything. So we need to know exactly how frequently is the situation. How, for example, let's say that there are the phone robberies or that there is this harassment. We need to know exactly how frequently these activities happen just to see the vulnerability. And some of these activities might be that there is this physical and verbal abuse during the promotion and the spread actions. If the data security is vulnerable, that they take the databases from the computers. If there is sexual harassment for those who are developing the activities, or if there's any kind of robbery or attacks to the clinics or to the facilities of the organizations, or if there is this systematic attack or this hate discourse to the organizations, by whom, if it's done by the press, or if it's a discourse that is spread throughout the community, or if it's there within that they've been attacked of doing these illegal activities, that maybe these might be confused as any other activities like consuming drugs in the public areas, or because in some other countries, for example, these sexual activities are criminalized. Sometimes it used to happen that they confused. They were detained just because of having condoms, because in those countries, condoms was an evidence of an illegal activity. So also in the field on-site field situations that we saw in Guatemala, Dominican Republic, and Belize, we have these express kidnappings. There were some people who were developing the testing activities, and we got to know about some of these mechanisms that they got kidnapped in an express way by supposed customers, and also they have this sexual, physical, and verbal harassment. Also, any kind of robbery was frequently, and other activities, mainly in the Dominican Republic, against Haitian migrants who were related with this deportation of migrant people. There were also some random detentions, and we've seen that frequently now in El Salvador, where there is a deception state and discourse is such that they are denying or they are against what gender ideology is. So we are also facing this situation in some other countries based on the influence of the extreme left and right wings. So these are some of the examples that we have seen in the region. So with all this information that we've been able to gather, the first thing then that we need to know is to organize the situation in order to determine exactly where are the problems. So for that, we use a very useful tool that you will know, which is the tree of problems. We need to know exactly what are the problems. They go in the branches. And we also need to understand what are the causes of these problems that are related with vulnerability. So understanding that vulnerabilities can be gender regulations, religious beliefs, criminalization, stigma, fear, and that in such a way, all these will feed and will nurture those risk situations that are documented throughout this diagnosis. So with that, I finished this first part on the framework, on the concept framework and the introduction to this diagnosis. This way, this first exercise, what we will do then is that we will collect information here to understand exactly what's going on, to understand what is the problem. And this is fundamental to develop the working plans. So, Karen, now you can continue coordinating the session. I will stop here, Cesar. Thank you, Anwar. Now I would like to open a space if there's any question for Anwar, or if you've been able to see. Any comment, any doubts, any questions? I heard that someone opened the microphone. Yes, Nelson. Hello. This is Nelson Valderrama from Cochabamba, Bolivia, South America. It is amazing and it is surprisingly and it is so useful to participate from these activities. I belong to the BOL network, people living with HIV here in Bolivia. And of course, definitely, these are topics that sometimes we don't take into account. Speaking about security, we just only consider that at an individual or family level, but sometimes we don't consider that for our organizations, networks, and businesses. So, and that is relevant. So just as an additional comment, in Bolivia, we've been able to develop in a specific study about safety and security, and specifically for the LGBT population. But yes, of course, we have seen that there are several pieces of information that there's kind of level of insecurity. We know that security for citizens or at schools and colleges and universities, we know about it, but we don't have that specific information and how terrible that could be. And that terrible, all those awful situations that the LGBT population had lived. There is a lot of insecurity in all these places. Let's say in the accommodation where trans girls go there. There's not a full security for them. There might be a camera, but then the next day they just appear dead. So we have seen several cases like that. So, and we're dealing with this transphobia aggression. So, and we know that phobias are different from those in Central American countries and the Caribbean, but as for compared with those in South America. So we still need to find some strategies and tools also that allow us to improve. And also speaking about these prevention strategies with regards to safety and security, not only of our individual institutions, but also with the state and the police. So this was just my comment. Thank you. Thank you, Nelson. Your comment is really so useful, Cesar, because let me tell you something here. In all the processes that we work with these countries, something that caught our attention was that many times organizations they had normalized violence. And what do I mean by that? Well, we were there in the field. We were there asking the people if they had experienced any type of violence or any type of problem from some of the other communities, or just the diagnosis as I just explained. We were there to develop the diagnosis, and people answer, no, we haven't faced that situation. No, everything is fine. And then, but sometimes they say, but remember that yesterday someone was hit. Yes, but they just hit him or her. They just hit this person and they just punch it, but they don't kill it. They didn't kill him or her. No, it was not so serious. But so what I mean by that is that sometimes violence is so frequent that sometimes we are not aware or we do not recognize it, or that we just include it on our daily activities, and then it loses its seriousness. So it is so frequent that it happens so frequent that we do not identify it, we do not see it. So a very common problem, Nelson, in this case, and that helps us a lot within this diagnosis, is to help people asking questions. How is your daily activities? How is your daily basis? So they can have the opportunity to describe it and also to have the opportunity to recognize situations that maybe from the outside are serious. Also, sexual harassment cases that sometimes they feel that it is normal, that they feel mainly with MSM. People think if they are being harassed through the application and they get those messages that they see it as something normal, as something regular, and they don't identify that as a risk situation, and they don't relate it that as a security aspect. So there are many situations that we can discuss and we can mention, but in general, something that we are perceiving or that we're looking at is that we have a problem to identify the violence, to recognize it, and to transform it then into an action to respond. So with that, I will answer to your comment. So thank you so much for that, Nelson. Thank you, says Nelson. Any other comment? Yes, says Karen. Karen, I just want, Karen says, also in the Belize's implementation, the LAC platform was there, and we were able to see that violence is so normalized now that I go to that place and I need to behave like this, because if I'm behave outside the norm, I can have some problems. And if I do not believe like they expect me to behave, then I will bring violence to that. So I also see here in the comments that they are answering and they are saying that they are asked to leave the places, to these public places, even though they are there for public populations.
Llama mucho la atención.
There is a situation that calls my attention, says Anuar, mainly when we work there at the Caribbean countries. In the Caribbean, the laws to criminalize homosexuality had been removed just recently. So that is to say that those laws had been abolished just recently, but still within the culture, within the general culture, there is a rejection towards homosexuality. There is this rejection of all these aspects that are related with gender identity. So this is something that, socially speaking, it's been rejected. Before that, it was worse. The situation was worse because it was based in a punitive law. And I think that right now there's only one country that it is still considering homosexuality as a crime. So what is the effect of that? The effect of that at a social level is that it is normalized. That is to say that, for example, as a protection measure, they decide not to be visible. So that generates a different dynamics. And by that, I mean that there is a different dynamics within the workplace, and it is very difficult that people will assume themselves or that they can express freely their gender identity. And why is that? Well, because general homosexuality and homosexual practices are cross-lined with gender issues, because homosexuality is seen as something feminine, and feminine is seen, female things is seen as something weak. So these regulations that are based in gender, obviously, and then at the end, it has a repercussion. And at the moment, the importance for us is how does that impact on the services? There is a series of several dynamics, and mainly in the Caribbean countries, but also in some other of Latin America. But what I would, for what I'm taking from your comment, because you were speaking about Belize, many times it is a problem being able to discuss about these topics, because it is also well interiorized, that situation of hidden it. These are barriers, of course, and it is there where we can identify clearly how vulnerabilities are structural. Gender regulations, the law, religious laws, religious rules, and at a community level, all those are not seen clearly. So the safety and protection were that part of the job, part of the activities refer to being able to mention, to name those vulnerabilities and to name those risks. So once that we identified and once that those are named, then we can move forward to develop the working plans on safety and protection. That's the way that we will act against those situations. Thank you so much, Anwar, says Karen. And now I would like to ask if anyone has any other comment, question, that any other contribution, because we also have another activity. So I would like to have this brainstorm on different ideas on how can we develop an risk analysis plan, so that we can have this safety and security plan. So there is one hand raised there. Asuseli.
Hi, good morning, everybody. This is Asusale and Melanie from BFLA. We're both in Belize, in the country of Belize. So here what we try to encourage our peer navigator to do is to once they go out in the field, we recommend that they work in pairs. The reason why is that even though, yes, there has been amendment to the law when it comes to homosexuality, it is still not accepted in the entire country. We do have different districts that yes, it is homosexuality, it is accepted, it is okay, it's normal. However, you do have different parts. For example, in the city itself, it's not accepted. So as long as you're openly gay, then you tend to run a risk of being targeted. It has happened, it keeps happening. So we, just for the safety and security of our peer navigators and also our clients, we ask that they try to pair up, because if you're paired up, then the chances of you being attacked, it's not as high as working by yourself. Also, what we do is if we have a male peer navigator, then he would be accompanied by a female peer navigator, just so that if there's any instance again, then the female can then step in and try to de-escalate the situation. Like it was Manuel, I guess, mentioned that this is something that we tend to not really look at when it comes to safety and security. It's something that we just overlook. But now that we're sitting here and I'm listening to you and I'm playing back what happens in the field, it's something that we take for granted. And I mean, I'm glad that you're presenting this today, because now it has me thinking, what more can we do for our peer navigators? Because at the end of the day, they're the one reaching the population. They're the one who have us meeting targets. So we need to ensure that they are okay in order for us to be okay.
Exactly. Déjenme responderle a Suseli. Le voy a
Exactly, that is correct. Let me answer Azuceli. I will answer in Spanish, Cesar, and that's exactly what we wanted to do in this following exercise. We wanted to ask you exactly what are the situations, what are the safety and protection security situations that you identified within your work. And this is what Azuceli is telling us. But the issue here that Azuceli is speaking about is the next part of this exercise. And that is, and you, how is it that you solve it? Azuceli is giving us clearly what they do is that a community worker does the intervention alone. They always go in couples, they always go in pairs, and sometimes they go in groups according to the level of risk. And thank you so much for your comment, because that is what we need to do, and that's the diagnosis. We need to understand what is going on, but also we need to know exactly that there are some other actions that we are taking in an intuitive way. We look at how is it that we are protecting ourselves, and what Azuceli is telling us answers to that. So thank you so much, Azuceli. So I think that there's another hand raised. There were two. María Victoria.
Fernando creo que también estaba.
Sí. Primero
Hola.
Sí, María.
Sí. Muy buenos días, mi nombre es María Bel.
Good morning, my name is Maria Victoria González.
Soy la representante legal de la corporación.
I'm the legal representative for people who will share with the live with HIV in Apartado Antioquia, Colombia. So I just wanted to say that we work with the LGBT and the trans girls on sexual workers and immigrants also. And looking at most of the situations that we lead, sometimes we need to go there, and sometimes the state, of course, is not interested in this population. So we, as the leaders, we need to be aware of this psychosocial accompaniment with regards of the HIV test and how to be there, because the state, the government agencies, they are not paying attention to that. They're just interested in the list, how many are there working, but they are not taking care of the problem on the mental health, on their health in general. How is it that they live, or how do they live or not, if they live in the streets or not. So this is of great concern, of course. Sometimes we do believe that whoever the authority that has to support us is the state, and we haven't received any kind of state, so any kind of support, sorry. Thank you so much, Maria Victoria. Thank you for sharing us what is it that you're facing in Colombia. And basically here you can see there is one issue here, Cesar. Safety and protection, it is not the same to deal it in an urban situation than in a rural situation environment. So there are several vulnerabilities according to the place you are at. There are urban vulnerabilities that might seem to be more dangerous, but there are also rural vulnerabilities. For example, weather situations in the Dominican Republic, when there are these very strong storms, the roads are closed, and that represents also vulnerability situations, completely different to the urban landscapes. Fernando, you wanted to mention something, or no, not anymore? And Fernando says, hi, I will open my video. Can you hear me? Yes? Yes, we can hear you. So thank you so much. Thank you for allowing me to comment. So yes, my name is Fernando. I'm part of the working team on the community coordination MCM in Peru. So we participate in the Lima Centro area. And so for us, from this promotion and prevention program for key populations, to do any activities from these community activities, it's something complicated in order to give access of our services to key populations. And why? Well, one of the reasons is that in this area of sexual activities where we have the cisgender and transgender male and female, in order to get there to this area, either to provide condoms or to provide any leaflet or any informative leaflet, or being able to do the HIV testing, it's almost impossible because they are immersed in the topic of their caregivers, for those who take care of them, and in those cases they pay a certain amount for them to be protected. But in reality, they say that they are protecting them, but that protection is more that they are in this situation and how many customers they have and how many customers they have per day. And according to that, that's the payment that they need to give them. So when we go and we want to do this approach, we face the situation that it is a fear situation. It is not easy for us to get close to them because we are under this situation. Whenever we approach them, they get close. No, these caregivers, they just come and they just ask what are the topics that we're dealing at, with whom we're dealing at, and that they should. So when we give access to information, that they should, or when we are giving them condoms and lubricants, because for them, as they say, time is money, and they don't allow them to get close to them just to create any type of conversation for prevention topics, because also what they allow is just to get close to the customers to do the deal and then go to the hotel. So that's what they are taking care of. They don't care about the others. How is it that they mobilize and how many customers they have per day? So that makes them be isolated from the service that we provide, for example. And also, on the other hand, our security in-hand is also there. And even though we go as a team, it is difficult. So what do? We need to coordinate that with the leaders, male and female, just so we can coordinate in some other spaces, such as the places that they live at, for example. But also, that will represent another type of situation, which is not easy because they are in any situation that whoever is there close to them as promoter providing information, because of the time issue, because of the time that they give in order to receive this information, it is also conditioned so for them to be paid. So they can comply on having the money, and they need to pay whatever is for their food and for their rooms. And sometimes even they speak about that they need to have money throughout the day to pay all this. So that makes that the system is not feasible to the problem that we provide.
Muchas gracias, Fernando. Mira, eso también nos ayuda.
Thank you so much, Fernando Cesano. That allows to understand also the nature of these activities. And this is kind of the idea that we're trying to document here. how does that community work happens? What are the challenges that they are facing? What are the problems that they are dealing with? The work with the community transgender female workers, based on what we have seen, I can say that biggest challenges are there, and biggest risk also, and biggest difficulties to reach them. However, as you are saying, there are many activities, just innovative and new activities that many organizations are implementing. So, Karen, I think that Women's wants to speak. I will give the floor, and then we can skip this idea, because more of this discussion is about that. This is what we wanted to do with a more technological aspect. But the important thing here is just to listen to your voices, to hear to your contributions, and to listen to your experiences, because within this diagnosis process, the most important thing is to understand exactly what's going on in the field. So we can be able from that understanding, we can transform these risk situations into solutions. So basically, that's the basic dynamics that we wanted to do in this work. So, Karen. Yes, I think that organically we did the exercise about this discussion on the protection, safety and protection in the field, and how is it that they had a deal with that. So in that sense, I think that we can end this with this last participation. And then after that, after the next presentation, we will have more spaces for your participation. So I give the floor to Wemis.
All right. Thank you so much. Good afternoon. So I wouldn't be very long. So I just wanted to talk about maybe quickly Guyana. So obviously in Guyana, we have a very wide geographic area, and certain parts, it's very okay. There's no protection issues. There's no security issues. But like in the hinterland and the deep rural areas, those are the places where, persons are being, their security is being threatened. And so just wanted to talk about the cultural nuances and the different understanding of the cultural norms, depending on the part of the country, that the LGBTQ community or trans women are operating. And so how society, sees them and the way they react. Over.
Thank you very much, Wemis. And I think, yo creo que el caso de Guyana también.
Thank you very much, Wemis. And I think that the case of Guyana, and I'm so glad that we have participants from Guyana and Belize, because I do believe that listening the situation that are faced in those countries from the Latin America, that helps us a lot to understand these safety and security issues that many times we do not recognize. And I think that it is also truly important to understand exactly what are the challenges from those countries such as Guyana, Suriname, Jamaica, and also Belize. Thank you, Wemis, for your contribution. Thank you so much, Wemis. So let's move on with Rosa now. Yes, so we already have this organic situation with regards of the risks. And another thing that we want to share in this workshop is to see exactly what are the tools that we have, how we use them, how we use those tools. What is the checklist verification, or what is that it is important to do it or to have it or to analyze it? How can we identify in a more precise way what are the main problems and what are the strategies that can be implemented in order to tackle it within the context of the country and what's going on within the country also. And also being able to reform these findings and this diagnosis, transform it into the needs of the objective on why we should have this safety and protection plan. So with that being said, we invite Rosa Gonzalez. She has been one of the consultants that had been accompanied us in 2 countries in this whole process on the protection and security plans. So now I give the floor to Rosa. Hello, everyone. Hello, everybody. I am willing to share with you these tools that we have developed from the platform. I've been privileged to apply in 2 countries, in Guatemala and in the Dominican Republic. So thank you so much for this participation, for your participation in this session. So before starting telling about the tools, I would like to do a summary for those who joined for the first time or for those who listen for the first time about this tool. So I will tell you about the story of this tool. This tool is being developed in the Región MENA, that's countries of Middle East, and it goes around 2019 and 2020. And from 2020, from the LAC platform, a work was done, a very intense work, just for us to know the tool and to understand the tool, but mainly also to adapt this tool for those countries of Latin America and the Caribbean. In 2021, we started then running a pilot program in Guatemala with those countries that Anna already mentioned, Guatemala, Dominican Republic, and Belize in 2021 and in 2022. And now, currently, we can say that this tool is already adapted to the Latin American and the Caribbean context, but also this is a tool, a dynamic tool, as we have said from the LAC platform team, and that is to say that this tool can be adapted. The tool itself can be adapted, and also saying that how this tool is being implemented in the field, this is not a hard tool, but this is a flexible tool. When we take it to the communities and when we take it to the places, to the communities, we do a revision session. We agree on the adjustments that the tool needs to have. So then the implementation is close to the context of those countries where the tool will be implemented. So that's like kind of the background. That's kind of the story behind how does this tool is being created and where we are at this moment. So as you can see in this slide, the toolbox, part of this toolbox has three main elements. The first one is planning. The second one is the checklist. And the third one is to develop those safety and security plans. So the assessment tool or the assessment element, here we can know exactly what's going on, what had happened and what's going on, and maybe we can project, we can figure out what will happen at a macro level within the context of the country, and how is it that this situation in different levels that we will see later on detail can affect significantly on the work of those organizations. And on one hand, they might increase the risk on safety and protection. But not only we do the assessment of the risks, but also we assess the opportunities. We know that organizations from the civil society, what we have found there is that none of the OSCE that we had worked with, none of them had a safety and security plan as such, but they have several guidelines on how to work or how to act in case that their staff suffer any physical attack or if their digital information was in danger. So we know within all that context of the country, as well as on the civil society organizations background. So we do the checklist where we try to go beyond and we try to go in depth on exactly what is going on, what's happening in all these different contexts where the operation or where the organization works, not only at a physical level, but also at the field level. And also, we just inquire on the political situations of the organization. How is it that all these might increase or reduce their safety risks? And finally, we develop the security and safety plans. So we will be describing step by step, one by one. So I was telling you the first element, the first tool, we do the context evaluation where we inquire about, let me close my camera. So within this tool, we do the assessment of the context as not only internal, but also the external context. In brief, I can say that within the external context, we inquire about what happened with criminalization of key populations, as well as on the actions that key populations might be doing in the field. For example, if condom is being criminalized, or for example, just to give you an example. Also, what are the strengths and what are the capacities, the skills that the programs have? What are the strengths and the skills of the organizations, or also on the civil society organizations that are implementing? And what happens with this political vulnerability from the state? If there are any policies that recognize the rights of key populations or that they limit these rights, is there any political instability, or can we speak about this change in the right-hand side governments, and that makes that key populations go backwards? And what's going on exactly with the financing situation? What is the public idea of key population, and what is the approach that they follow? And another thing that Anwar was saying, or what he was speaking about, we also inquired on the location of the organizations as well as on the actions, on the prevention actions, what they do, if these are rural activities or urban activities, what are the contexts that they live in, because those might be completely different. Sometimes we don't know unless you are there at the site. You might inquire, or you might see that in the rural areas there is a better understanding of trans women, or for example that the criminalization topic is higher in the cities. So that is why it is truly important to run a context diagnosis. And then what happens later? What happens with the role of the church, for example? What's the role of the religious institution? And in that sense, we keep to inquire on different factors that may put at danger or might put at risk the work that is done by the key populations and the key populations itself. Also, we help the organizations to do an internal diagnosis with regards of the structure of their organization, with regards of the rural regulations, norms, and if there is a rotation on staff. As for prevention and mitigation topics, we analyze several strategies and the articulation that is given there with some other external actors that might push this political situation. So it is important, as Anwar was saying, to document all those harm situations in those unsecured areas. Why is it that it is important to document? Well, it is important because we have seen in so many cases, some of the risk cases that the organizations experience within the implementations, they remain there as just a story that was told, as just a gossip that was told between the people, that someone threatened me and they just robbed the cell phone. But there is not any documentation. There is no report of that specific situation. So it is important to document all those harms that are received or that are being identified. It is also important to verify the attention points and the offices and to keep safe not only the employees on field, but also virtual employees. Because we do believe that virtual aspects is also, the virtual factor also makes vulnerable the key population that are working using several applications. Also, as for mitigation aspect, it is important to develop these protection manuals. We found that there's no any organization that have a protocol, a security protocol, and also to keep data safe. As for the practices and prevention and mitigation, the tool itself also provides several case studies. Those case studies that are there from Guatemala and also from the Dominican Republic. I'm not for sure if there's one in Belize. So, in order to answer to these challenges that Mateo already shared, it is truly necessary to implement the approach on the HIV programs. And what is that approach? Not to harm others. That's one of the principles. Let's say that's one of the principles that we should follow. And what we're looking at with this principle, to prioritize the welfare and the well-being of the employees, to report any situation that is at risk whenever we try to answer to that risk situation. just in order to answer that, we want the situation will be worsened, and that is to say, to not to report the accounts or to do a good use of the information, digital information. So we need to be aware of that. Whenever we respond to a risk situation, we need to be aware that this answer won't create any harm. Also, Mateo was speaking about nothing about us without us. And what does that mean? Well, that means that all those actions that are being delimited in this study plan should be analyzed, should be consensus, and should be decided by the population that are offering the services and that are there at the field. And also, it has to be a rights approach. We need to protect and preserve the human rights of all the employees from the implementing organization. And also, this has to be an approach based on the country. What does that mean? Well, despite the fact that there is a tool that already has a series of different guidelines and orientations, that doesn't mean that the technicians of the platforms, for example, or any other organizations that are implementing the tools will direct the action. The action is being guided by the decision taken from the country, whoever is giving the technical assistance, and mainly from those populations that are running directly from the Global Fund. It is also important to assure the financing for the protection plan, not to leave it randomly. For all those activities that are being defined, should have a budget. Also, we need to identify during this field diagnosis that there are certain actions that should be and that are taking place with a minimal budget, or some of them without budget. Well, we need to be sure that on how is it that they will be implemented. So far, financing has been done through these efficiencies, but we also heard that as for the new windows, it is sure a percentage is being guaranteed in order given to the protection and security programs. And we need to be sure that everyone knows the whole program. We cannot keep the program just in the hidden. It is important to assess also the risk level that the organization has. I think that there's no any other organization working on human rights that may not assume any kind of risk. And in this sense, the analysis here is that how far is it that the organization, the leaders of the organization, men and women, the field workers and the coordinators of the programs are truly, or they truly have the capacity to accept the risk. This is part of the discussion that they should have in order to develop the security plan. Also, it is important to recognize that there are different vulnerabilities from each one of the field workers, male and female, and not only at the field workers, but also the coordinators, the directors of the organizations. And among these vulnerabilities, we also tried that organizations should be clear on that, and they can highlight them. For example, with regards of gender, who are more at risk? Are we speaking about youth, gay men, trans women, or because of age? Let's say that younger people are less vulnerable than those age, and also legal status. It could be, for example, that organizations are giving opportunities for those who do not have this legal status in the country. Or it could be also that because of giving that service to those who do not have legalized their situation or their stay in the country, that might generate more risks. We have already seen that in some countries, mainly in the Dominican Republic, with those workers that are migrating from Haiti to Belize. So it is important to depend one another, to rely one another, and it is important also that after COVID, this has been taken again. We need to speak about mental health of those workers from the organizations of civil society. this has been demystified. So many levels have been taken out of them from those who need mental health services, where either they are not sick, so this is a need, and that it has to be included in the safety and security programs. Those plans should be considered. Now let me speak about, if I'm speaking fast, please let me know. So now let's talk about tool number 2, which is, this is the checklist on security strategies. Let's say that this is a checklist just to do a checklist of the implementing organizations, just to see exactly how is it that we are answering to the needs of security. So in this sense, I will try to explain the context of this tool. So here it is, the checklist. This tool is being designed not to replace whatever the organization is doing so far. The idea is to identify some other elements that can be used or what can be improved. So let's say, for example, that the organization has a minimum strategy on security and safety. Maybe it is not in written, but there are some elements that are considering or that they are taking into account, and that they are developing just, let's say, because of common sense or based on the experience, they do it already naturally. And also, this checklist helps what is it that it's been there and what is needed. So then it has to be systematized through a security and protection plan. Also, this checklist is a friendly checklist where we gather general information of the organization. Let's say, for example, what type of organization, what is the population that they work with, where is it located, what are the minimum security measures that they are implemented already, if they are, and also we gather information from the people who work there as for safety and security measures with regards of the risks that they might be facing. So we do the same with all the places, with the working places. We also inquire about the personal security issues, as well as on the processes followed by the organization to increase security and safety of their staff members. We also help the organization to identify the needs and opportunities that the organization has in order to increase safety and protection. Also here, we include whatever is there, we inform of the urgent situations that need to be solved as for risks matter, not only for the organization, but also for the Global Fund program that they are implementing. Within this checklist, we pretend that it includes participation. It is highly participative, and that it gathers experiences from all those who are involved, from all the roles that the organization has in order to implement the Global Fund program. For example, to involve the executive directions, the program coordinators, the field staff, as well as some users, male and female, some users of the program. Here we also see the communication, confidentiality, and revision. And the idea is to share only the results of this analysis from the checklist. And also, the tool provides some scenarios that could be a guideline to develop the program itself on safety and security. Finally, we have the methodology to develop those plans and projects on safety and security. So how does this plan is being implemented? Participants, most of the people who were interviewed within the field activity, and sometimes it was online. So the idea is to pretend that for those who've been doing this safety manual, they participate also in the workshop to implement this tool number 3. This is a workshop of 2.5 days or even 3, where they start with a discussion on all those who are involved on the findings that were found during the security analysis with tools 1 and 2. So here it is that this prioritization exercise is truly important, because it happens that we have those events, for example, where risks, where protections is being at stake, and there are a lot of risks. And as Anwar was saying, the importance of listening the other help us that that those organizations are able to identify exactly what are the things that happen in field and that the leader or the coordinator are facing when they do their activities, or it could be to the data itself. So they should be included in this protection and safety plan, because I totally agree in that sense that whenever we have said throughout this session is that it is already risk is already normalized, it is naturalized also. These elements, these risk elements that sometimes we are not even aware of those. So what happens with these tool 3 is that we do this prioritization exercise, and also it is related with the resources available. Then an action plan is developed, and also it includes the budget. The budget represents always a challenge, because there won't be enough money in order to respond to those protection and safety measures that all those members should have or having in the key population field. So that's why we need to run this exercise. We need to prioritize. And another challenge is sustainability. How do we make it? How do this safety and protection plan is being sustained? There are some other ideas that provide this guidance, and that is to strengthen those actions that might not need money, but that are related with political decisions from the directors, from the boards, from the organizations, or to include flexible schedules, not to work in an area that is an isolated area and put them in danger. So that doesn't affect significantly to the budget, or that doesn't demand a specific budget. And some other political decisions. Let's say, for example, to institutionalize this plan, to be part of the programs, and in a way to get some resources to finance a safety and security plan. And beyond the resources from the Global Fund, or just at the end of the Global Fund, so then that the organization can have a protection and safety plan that can be ongoing and continue throughout the process once the Global Fund grant is over. So this is what I wanted to share with you in this session. Thank you so much, Keren. And just as a reminder, what Rosa just shared with us, I just included in the link in the chat box. I included the link in the chat box, the toolkit in Spanish, in English, in Spanish, and I also included the 3 case studies from Belize, Guatemala, and the Dominican Republic. All these links will be either in Spanish and in English if you are willing to learn more about these projects. And if you also want to know how is it that these plans were developed and how the implementation was done also. We are still having 17 minutes before closing the session. So now I would like to open the floor again. If you have any questions, if you have any specific doubt with regards of these toolkits or with regards of the implementation, or if you have any other recommendation, if you would like to start doing this analysis, if you need any advice, you can either write in the chat box, raise your hand, open your microphone, this space is for you.
Sí, Fernando.
Yes, Fernando?
Sí, gracias. Sí, yo solamente,
Thank you.
siguiendo la
Well,
sesión que estamos conversando,
following what we're just mentioning here in this workshop, I would like to say that it is valid to include this topic, to include this reflection aspect. We as community organizations who work with key populations as a grantee of the Global Fund, it is important that the work that we do basically is focused on the topic of giving access to the programs that we provide within the human rights framework and that we give to our communities, such as the fast test, the liaison, and the delivery of packages. And in this case, I think that this is the reflection. It is the work of this organization that is based in that. It is based on that, so it is not based from the implementation or on the elaboration of the programs for this community offer. Had considered this topic that we are working on right now, safety and protection, and to have a plan for that. It has not been considered throughout the time, and it is now that we are having this challenge as for safety and protection. Because also we are centering on speaking about safety and protection in the field, and that is valid also. But it is also valid within the spaces where we offer the community service with our key populations. It is there where we are finding right now a lot of difficulties because of that safety and security. So, for example, within the organizations, they are also paying for this right of occupation with this facade that I will give you security and protection, nothing will happen to you. And also the topic of who reaches us to receive these programs that we offer on promotion and prevention. But at the same time, they have another intention. So this is what we have noticed there. Based on the experience that we have here, another intention there, also from the key population that get close to us, as we have perceived, they are inquiring the space where we are offering the service, what are the type of equipments that we have, who asks questions, for example, or indirect questions, who being financed, where is it that they take the funds, are you volunteers for doing that job or not? So these type of aspects are also there, and they give us certain warnings also, and as well as fear. So this is what we face on a daily basis. For example, in the service that we provide in Lima Center, there used to be this proposal that in the room, in the reception area, where people come and ask, let's say that this is like a waiting room where we provide the attention, and the idea is to place, let's say that we place a TV monitor just as a tool while they are in the waiting room. But this is impossible because facing this situation that they just reach the place and they have these bad intentions, they just see exactly what are the equipment that the organizations have. And in that sense, they have this fear so that later on might happen these robberies. Even speaking about the use of weapons. So that creates this fear, and also that creates a limitation within the services that we offer. And this was not shown before for us to have a security and protection plan, because basically the work is being focused on giving access to those programs and also to comply with the indicators and the goals. In that sense, fear is put in the table, being able to develop any activity or any work without the fear of being threatened. That's why we also spoke about mental health issues, because you are like defensive and who comes and who is not coming to those services that we are offering. Not only from the population that comes to receive the service, but also from others who are there in the surrounding areas and or around the organization. Such as this question that you made, that we assume and we see the intention. So when we see that the person is looking at the place and looking at the areas and what are the pieces of equipment that are there, if you have a camera or if you don't have it, and they ask you, do you have it, or if the camera is on or off, or if the camera is just like an element there. So those are the things that we need to be alert of, and that will take us in a situation that for the next grants should be considered also to have the support for those communities to include this safety and security plan, and also what could be the strategies. So in any case, any situation is happening that we don't want it to happen. So that was my comment as a reflection, says Fernando. Thank you so much, says Karen. Yes, that's right. The security this is something that has to be prioritized when we are working in the rural areas, because we have seen that in the last two cases, all these risks that are there that are already normalized within the communities. So before giving the floor to Maria Victoria, I will share another link. That is the one from the newsletter of this month, the platform newsletter, and the topic is safety and security, if you need more information about that. And the newsletter will be in English at the end of this month. And also the recording of this webinar will be there, because someone was asking about sharing this, and yes, we will be sharing. So thank you again, Fernando, for your comment. And there is Maria Victoria Gonzalez, who's also willing to speak. Maria Victoria, you can open your microphone. Maria Victoria Gonzalez, you can open your microphone. Hello? Well, in the meantime, let me ask again if there is any doubt, inquire, comment. I've just left all the links in the chat box. So hi, says Maria Victoria. I was having some problems with my microphone. I just have one question, said Maria Victoria. For any reason, does the Global Fund is supporting Colombia? Here in Colombia, in Antioquia, one of the municipalities, because of the armed conflict, we have received the support from the Global Fund, but that was long ago, because our organization received the support from the Global Fund, but yet we haven't had that support, and if it's needed for those packages, because here the hospital, as I told you before, didn't receive the support to work with these street, so they don't share needles and lubricants. So I think that it is excellent, the support from the Global Fund. So that's my question. Thank you. Thank you, Maria, says Keren. I will give that to Anwar, and Anwar is answering. We don't have details of these grants in the countries. So what I suggest you is just to get close to the MCP from Colombia, so they can give you more details on how is it that they are working. How is it the principal recipient and this secondary recipients are working, and what are the activities of the grants, because we do not have that information. So what I can tell you is that Colombia, yes, it's eligible for grants, but the details you can get them from the MCP. Thank you so much, Maria Victoria, just wrote in the chat box. So then Karen says, in the last 5 minutes where we have the space of one more participation, I will kindly ask you if you can help us on filling in, answering a 4-question inquiry, a 4-question survey. The survey will be shown in the screen. This is just a brief survey that will help us on how can we improve the workshops. What do we need to focus on when we are speaking about safety and security, and how do we implement? So these are just the multiple selection answers. And the last one is just to give, if you want to give a comment. So if you can answer. If you have any problem in looking at that. So thank you for those of you who are answering this survey. So in the meantime, I would like to give the last floor to our colleagues from the platform, just like a final message or any other recommendation. So I will give you 1 minute to Rosa. If you can give us like the last suggestion when we started to implement the toolbox. Thank you so much, Rosa. I would like to encourage those organizations that are implementing these activities with the Global Fund and key populations to look with your MCPs on the possibilities on requesting the implementation to elaborate a safety and security plan, because I do know that other countries will have the opportunity to have the funds to do it. And also from the platform, we can answer all the doubts or the questions that you might have, or the intentions that you have. We can expand the information, we can help you on requesting that, and that's it. Thank you. Thank you. And now we close this first virtual webinar. So now I give the floor to the technical director, Anwar. Thank you so much, Susana. Thank you, everyone. Thank you, everyone and everybody, for being here this morning today with us. This is the first time that we're working with this new modality. Hopefully, we can continue with this. We see that there is a great difference between just mainly looking at your participation and the interaction that we have. This is the format completely different, so we can continue on this line. I would just like to highlight two aspects. The working plan has to be based in the actions that had been identified as risks, and these need to be turned into the identification, into the needs identification, and then needs need to be transformed into objectives, and then objectives need to be budgeted. So one of the greatest challenges that we are facing is that on a regular basis, there's no money to implement the safety and security plans. So for those of you who are linked with the Global Fund grants, for those of you who in your countries there is a Global Fund grant, it is important to get close to your representatives within the MSP, so to state the need, mainly for those who are doing these sub-grants or sub-grants, to emphasize this need and to promote and to push that security and protection is being included within the activities and within the concepts, within the main concepts of these grants that the country is showing to the Global Fund. Also, we can consider resources from other sources. But I think that an important message that we need to keep on launching is that the implementation work from the Global Fund grants are intrinsically related with vulnerability and protection. So therefore, as it is budget, as actions are being budgeted with all these operative activities, we need to keep on working. So within the grants, there is an item on the budget for safety and security for those who are implementing the grants. That will turn this topic of safety and security an issue not to be financed just sporadically when there are certain savings within the grant. No, but to include it as a sustainable action within the time or within the period. So my suggestion is that please ask with your recipients and subrecipients and sub-subrecipients and main recipients so we can make the topic of safety and security a relevant topic, an important topic within the implementation of the Global Fund grants. So with that, I close my participation, and there's no more than thanking you for being here today, this morning with us. Thank you, Rosa, for your contribution. Excellent presentation. Thank you, Karen, for facilitating this workshop. Thank you, the platform team, for their support, and thank you, everyone, for being together with us this morning. Thank you so much. Thank you, everyone and everybody who remained until the last 2 hours and who help us on answering the survey. That will be truly useful for the next workshops from the platform. Any doubt, any question about the tool or the newsletter, please let us know. You can reach the platform, me or Anwar, and we can help you. So thank you so much. Have a great day, great week, and thank you. We will be also sharing the recording in the website. Thank you so much.